Normally, I get everything ready for Dr. Haslam. Drugs, laryngoscope, the right-sized tube for the patient.
That's right. And then
McGill forceps, sticking plaster, a small syringe to inflate the cuff on the tube.
Yeah. And then
Check the cylinders, top up the halothane, make sure the flow meters are working. I'm also responsible for anything they might need in the theatre, like sandbags to keep the patient in the right position, or special bits for the table, like an armrest or lithotomy stirrups.
Thank you. Then, of course, I just stroll in with a sausage sandwich and a fizzy drink. I have a kip on the bench and I knock off as soon as possible after the pub's open.
Handcuffed. That's what Dr. Haslam said. Jonathan, did you agree to one of our patients coming in here handcuffed to a prison warder?
Yes.
Why?
Douglas Endicott is not any old patient. That guy embezzled £2.5 million from one of the biggest companies in Britain.
Oh, I see. And you're afraid he might escape and commit a major fraud in the sluice room?
No. They just said if he does a runner, it could be embarrassing for the government.
Jonathan, how exactly is a 55-year-old stark-naked man with a hernia supposed to do a runner?
Well, I don't know. Look, I am not arguing with that prison warder.
Why not?
Because he's about 9 feet tall and is built like a brick boathouse. Anyway, what does it matter?
It matters to me. I will not have people dictating what goes on in my theatre. I don't barge into Wormwood Scrubs and tell them all to stop slopping out. What?
Nothing. Look, we've done all this before. You just take the handcuffs off when the patient's asleep.
Oh, so I won't actually have two people lying on the table.
No.
I'm surprised they want us to anaesthetise him. Why don't we just belt him round the head with a rubber truncheon?
£2,000?
Yes.
How'd you manage to save all that?
By telling my family that baked beans are highly nutritious. Also, I found out that sending my husband's suit to the cleaners wasn't half as cheap as buying some polythene and a wad of cloakroom tickets.
You're rich.
Well, I wouldn't say that.
Yes, you are. You can afford anything. Now, listen. You've got to be careful with some of these clinics, because I've seen people go in for a facelift and come out with their eyebrows halfway down their back.
Facelift?
Personally, I think you're daft for having it done. I mean, you're really a very attractive woman.
I know, which is why I have not saved up for a facelift.
Oh.
And I'm not having those done either. I intend making my money work for me. I'm going to invest it.
In what?
Well, naturally, I've been studying the financial pages before I make my choice. Now, apparently, Nush Grupp is doing very well at the moment.
Nush Grupp?
Well, that's not the full name. Nush Grupp is an abbreviation.
Of what?
Mind you, I'm quite interested in some of the others.
Oh, yeah? Which ones?
Well, there's Ooted Prog. That's gone up 3p since yesterday.
Ooted Prog? What's that short for?
Well, it's quite a long name. You wouldn't be interested.
Yes, I would.
No, really, you wouldn't.
You don't know.
Well, of course I don't know. Have you read this? Look, Brit Brock, Brat Org, T&P Puckins.
Well, obviously, the best of those three is Brit Brock.
What?
They declared very good figures for the first quarter of this year, and someone told me they've got a $3 billion capital advantage, which could mean a major rump in the ventures market. Anyway, I'd best be off.
No, hang on. Show off. Show off.
Good. Well, I think that's a lot. Excuse me, could I ask, who told you to wear those?
I told him that that's what visitors here normally wear.
Not if you're hoping to start a family. Now, I have to ask this because they can be dangerous during an anaesthetic. Are you wearing any false teeth?
No, they're all mine.
Oh, a false nose, maybe. Or a crudely made belt with little pockets for a hacksaw blade and a fake passport. No. Oh, good. We're very hot on security here, you know. You wouldn't believe the amount of patients who manage to saw through their leg shackles while the searchlights are pointing in the opposite direction. Oh, well, I better just nip into Theatre 1 and make sure the dogs have been let loose. Maybe we can meet up later by the machine gun tower.
She's a laugh, isn't she?
Investments?
I just wondered if you could give me some advice.
Well, it's a fascinating subject. Unit trusts, guaranteed income bonds, personal equity plans. What exactly did you have in mind?
How to make bundles of cash.
Well, the first thing you must do is to go along to your bank
Yes.
with a small gun and a note saying, don't call the funds.
Do you think I should ask a professional?
Good heavens, yes.
Anyone in particular?
Well, Buster Edwards used to be quite good, but then he never did a bank job. I did hear of a consummate professional called Mad Dog McGillicuddy.
I meant a financial advisor.
My dear woman, No financial advisor knows how to make large amounts of money.
Why do you say that?
Because if they did, they wouldn't tell anyone.
No, they'd put a sign in their window saying young ladies required to crew yacht bound for Tahiti.
All right, put it this way. If you suddenly came into a reasonable amount of money, what would you do with it?
The most sensible thing I could.
What's that?
Hide it from my wife.
Right, let's see if we can find a vein, shall we, Michael? Yep, there we go. Now, this won't hurt.
I should warn you, I'm a bit of a coward.
You just feel a small jab. Okay. Are you feeling all right? Will you not stop moving and get him out?
You mustn't worry about him. He'll be all right.
You're all very kind.
Actually, I'm not really a nurse.
No?
No, I used to be years back. But then it got to the point where I wanted to have a family. And they offered me a job in administration. So I thought, well, it's more money. Although Alec, my husband, has got quite a good job. He's a school teacher. Anyway, I always discuss everything with him. And he said...
I spy with my little eye something beginning...
I am sorry about this, Sheila.
No nonsense. I feel quite proud. I'm the first woman in history to remain sterile this long without an operation.
I'll get him off to sleep.
I think Joyce is already doing that.
But I said it's not just the money. I want to be there when my children come home from school. Because I think that's what being a mother is all about.
Joyce.
Anyway, Oh, well, it's been very nice having this conversation with you. Because that's really what you miss, you know, when you give up nursing. The opportunity to meet all kinds of interesting
Joyce.
people.
Right. Now, like I said before, you won't feel a thing.
Thank you.
You'll just drift gently off to sleep.
Yeah.
Now, just try counting up to 10.
1, 2, 3. Ah. God, you're gorgeous.
Who does he mean?
I think he meant you.
Don't talk rubbish. I think you'll find he meant me.
Well, he's been smiling quite a lot at Dr. Haslam.
All right, it doesn't matter.
Well, Mr. Endicott and I have been having quite a nice conversation.
Joyce.
Well, I can't think why he thinks he means you, and it's quite obvious he meant me.
Can we concentrate on what we're supposed to be doing?
Who would have thought that a hot stuffed potato in its jacket could taste quite so delicious?
You're not just saying that to please me?
I'm ready to branch out into Savoyard chips. Southern burnt rooster.
What's up?
I was just thinking that that lump of wood is probably the most attractive thing you've ever had in this garden. Except the dustbin.
Sheila, you can make jokes, but this is quite an emotional moment for me. It may not look much, but I spent many happy hours in this garden.
Doing what?
Yelling at the twerp next door to stop playing his blasted organ. It's one thing I won't miss. Waking up at the crack of dawn to someone bashing out bossa novas.
Jonathan, I should think there'll be quite a few things that you'll miss now that you're living with me.
I'll miss my shed.
Shed.
Out the back. I built it myself.
I never noticed you had a shed out the back.
Well, you can't actually see it from the house. I haven't mowed the lawn for 3 years. Why do you ask?
Well, I know I always make jokes about your house and say it's crammed with things that you normally find sticking out of a river at low tide. But the truth is, it really is quite... Well, it's really quite,
A dump.
Yes. But only because you're moving out. I mean, if you weren't moving out...
I've got to move out. I've sold it.
Well, what if something goes wrong? I mean, what if the person who's bought it suddenly backs out or falls under a bus?
They signed the papers. The money is now in my bank account. They own this place.
Well, maybe they'll sell it back to you at the same price.
Sell it back?
Yes. Well, I mean, think of all the things you've done here, and, you know, and the garden. I mean, I should think at certain times of year that garden is an absolute picture. Plus, you can make wine from dandelions.
Sheila!
What if something goes wrong between us? What if I come to the realisation that I really like small, dark men and fall in love with a Shetland coal merchant? What if you pull into a roadside cafe and find you're turned on by women in nylon overalls and carpet slippers? What if it's all a terrible
For
mistake?
God's sake, what is the matter with you?
Oh, I don't know. It's just seeing that man today, handcuffed to someone else.
We're not comparing those two to us.
No, of course not. In 6 years' time, one of them goes free and he's still got £2.5 million quid.
There is another difference.
Well, yes, I suppose their relationship lacks a bit on the physical side.
That's right. Although I think one of them might be living in hope.
What do you mean?
Oh, nothing. Look, we're not doing this because we have to. We're doing it because we both know it's going to be brilliant.
You've got no doubts at all.
None whatsoever. Look, if you're going to carry on like this, I'm going to get
Don't be
straight.
so grumpy.
My goodness, we had some fun and games yesterday, didn't we? What a rumpus afterwards.
Rumpus?
Of course, you missed it. You were working. That was wonderful stuff. First, that poor prison warder fainted in the anaesthetic room. Well, he wakes up on his trolley, can't find his prisoner, and twists his ankle, scrambling to the floor in a blind panic. Then he flew into terrible rage, thinking that somebody had stolen his handcuffs. And some people pay money to watch satellite television.
Speaking of handcuffs, what did you mean last night when you said, I think one of them might be living in hope?
Oh, nothing.
No, come on, I want to know.
Well, I think Mr. Endicott likes me.
I wouldn't count on it.
Likes you?
Yeah. As I was inducing him yesterday, you know what Pentathl's like? And as he was dropping off to sleep, he said, God, you're gorgeous. Funny, I'm not surprised. I have been called the hunk on occasion.
Hunk of what?
I knew it! You're just as jealous as she is.
I'm not jealous. I just don't think he likes you.
Why?
Look, I've been dreading saying this, so I'll just come out with it. Mr. Endicott has been complaining to the ward sister that he felt things during his operation yesterday.
Things?
Pain. He's claiming he was insufficiently anaesthetised.
That's ridiculous.
I know, but you had to call me. Because he's now saying he's going to sue you for malpractice.
Gerald, now think carefully before you answer this. In the recovery room after the operation, did Mr. Endicott say anything about having felt any pain?
No.
You've checked with all the nurses?
Everyone. They all say the same thing.
Good.
He was fast asleep.
Uh,
What's going to happen to Dr. Haslam?
Oh, don't you worry about that. With Sheila and me on the job, Jonathan can rest easy. No stone is going to be left unturned. We are going to be turning this place upside down.
Joyce.
And every shred of evidence will be very closely scrutinised. And I can promise you this, there will be no hiding place.
Joyce, put a sock in it. We're not Cagney and Lacey.
Well, I'm just so angry.
Well, I wish you wouldn't be. You're cutting my shoulder in spit.
Will there have to be a court case?
If Mr. Endicott wants one, yes. And he will be shown up to be the lying, vicious con merchant that he is.
That's right. And make no mistake, Jonathan's barrister is going to be frying his backside.
Yes. Always assuming we can find one that's a qualified griddle chef.
Intellectually, the man is bereft. Jonathan, you mustn't sit here moping like this. There's work to be done. Patients waiting to be restored to physical fitness. Hip replacements, hysterectomies, laparoscopies, lobectomies, tote that barge, lift that veil.
Coffee?
Yes, thank you. Anyone see my copy of Hello anywhere?
I'm just trying to work out if what that guy says can possibly be true.
Of course it's not true. That man is a convicted embezzler.
Well, that doesn't mean he's totally dishonest. It doesn't mean we can ignore everything he says.
Well, no.
George, he's a human being. He's got rights like everybody else.
Look, I'm sorry. I think allowing someone like that to have rights is wrong.
It is not wrong. It's a fundamental principle of civilized society. If that guy thinks I muck things up, he's got to be allowed to say so.
Yes, if I could just pose a bijou questionette at this point. Whose side are you on?
Neil...
No, I'm only asking because it seems to me that this chap Endicott has a perfectly good point, and you're saying that you ought to be strung up by your adenoids on Tower Hill.
I do feel we came in here to offer you some moral support.
To let you know that the staff in this department are all rooting for you.
Where's the point in them rooting if you refuse to root yourself?
Oh, it's the first time anything like this has happened to me. I've got to be absolutely sure I didn't make a mistake.
I refuse to believe that a man of your experience and caliber could possibly have made a mistake.
Thanks, George.
Did that sound convincing?
Oh, yes.
Good.
And during the operation, did you notice anything out of the ordinary?
No, pulse rate, blood pressure, everything was normal.
Sheila, I've been thinking, surely the best thing for me to do is to go and talk to Endicott.
No, the best thing for you to do is to throw him off Land's End tied to a bin bag full of bricks.
Lord.
Mr. Endicott is a very clever man.
So am I.
Yes. But you're clever in a different way. You know, mathematics, physics, building your own garden shed. Mr. Endicott's particular forte is doing to society what animals always seem to be up to in those nature programmes.
Well, he can't be that good. They put him in the nick for 6 years.
The man's a genius.
Why?
He's only been there 4 months and society's still getting rumpoed. I wouldn't be surprised if he's got a cell with shag-piled carpet and a little sign that lights up and says, Mr. Endicott is out.
All you know is what you read in the papers. Have you ever considered the possibility that he might be telling the truth?
No, I've considered the possibility of spiking his drip with slug pellets.
Well, I've got to be sure, and the only way I can do that is by talking to him.
Oh.
Look, don't worry, I'll take a witness.
All right, come on.
No. I thought I'd take Joyce.
Joyce?
Well, I want someone who's not going to get too excited.
You'd be better off with a Yorkshire Terrier.
I'll go.
Yes, Michael, great. Now, look, we've not come to duff him up. We just want a quiet chat.
Okay.
No arguments.
Bye.
Hi, George.
Hello.
What are you up to?
Well, as you may know, I've got a certain amount of money I'm thinking of investing. And since Mr. Endicott used to work for quite a large investment bank, I've...
Work for it? They're still looking for 2.5 million quid. He pinched from it.
I didn't really come for advice. I'm using it to gain his confidence, to see if I can turn the conversation round to this malpractice business.
And?
Well, he said, what you must remember is that investments can go down as well as up. So the best thing for me to do...
Did he say anything about Dr. Haslam?
Oh, no, not yet. But he's inviting me back tomorrow for coffee. Oh, by the way, I was the one he thought was gorgeous.
Well, I'm blowed. More visitors.
I hope you don't mind. I thought it might be a good idea if we had a... Oh, excuse me. Oh, stopped.
It's my bleep.
Oh.
Now, look, listen. I've been thinking of sending you a small present of some sort. Do you like champagne?
Not much.
Oh, I love it. Couldn't get me some, could you? I'll give you the money.
No, I could not. If you remember, I'm the one you're suing for malpractice.
Yes, well, that's not definite yet. I've got a list of people I might sue. It's just that you're at the top.
Nice.
Well, you can't blame me. I mean, if a person feels pain during surgery, it must be entitled to compensation.
I'm not convinced you did feel any pain.
Oh, I didn't.
What?
No, I was out cold. I'd feel terrible if you were blaming yourself. You gave a marvellous anaesthetic. But you mustn't be upset if I don't say that in court. You see, with a case like this, where nothing can be proved either way, it's basically my word against yours. So I'll have to claim I've had nightmares and try to blacken your name as much as possible. But you mustn't be worried, because I actually think you're a brilliant doctor.
Can't sue people when they haven't done anything wrong.
Yes, you can. I've done it twice before.
He's got me.
Rubbish.
That guy's brilliant. He's got a way of saying, I'm going to club you for every penny you've got that makes you think, oh, well, that sounds reasonable. I'll toss in the BMW. He's such a nice chap.
What of the medical defence union, sir?
They can't do anything until he makes a formal complaint.
There you are, he's bluffing. I bet he hasn't even got legal representation.
I bet he's got rump-hole of the Bailey. Sheila, what am I going to do?
Well, it looks as if it might go to court. So the first thing that you must do is find a pair of socks that match. And then you must get a large black bin liner and put all your suits in it and mark it crematorium.
Is that all you can suggest?
No. Avoid that tie that looks like you're wearing a tuna fish.
Thank you.
Of course. If you want me to knacker Mr. Endicott before it gets that far.
How do you mean?
My God, you're gorgeous.
Yeah?
No, not you. My God, you're gorgeous. That's the answer.
Yeah? Well, if you tell me what the plan is, maybe I can help.
No, I'll do it myself, thank you. Morning. Oh.
What the hell?
Morning. Remember me?
Yes, of course.
I'm the one who fixed your hernia. But I could just as easily give you another one. Tell me, is it causing you any pain?
Not at the moment, no.
Would you like it to? It can be arranged.
Why does she keep saying things like that? It's not very nice for me. I've just had an operation.
She's not trying to be nice. I told her you said this was all a big con.
You did?
Yes.
But you can't prove I said that.
Well, no.
Ah, that's all right. That's perfect. See, what I could do now is sue you for slander as well.
Oh, I don't think you'll be suing Dr. Haslam.
Oh, I must. He allegedly made a terrible mistake during my anaesthetic.
Well, you know, funny things can happen in an anaesthetic room. For instance, we use this drug called pentothal. You've probably heard it mentioned in legal circles. It's sometimes known as the truth drug. The reason being that when we inject it, people sometimes say things involuntarily, just as they drop off to sleep.
They do?
You know, embarrassing things like, don't tell my wife about Trixie and, God, Dr. Haslam's gorgeous. Or where they've got £2.5 million stashed away.
Oh, that's brilliant.
No.
Of course it is. I'm sitting here, worried sick in case I said something. I don't think I did, but you know I can't be sure. You've beaten me.
Well, of course, if you'd still like to sue Dr. Haslam.
No. You completely beat me.
Oh.
My God, you hang on to this woman. She's an absolute genius.
I still think that's absolutely revolting.
Listen, we really must have that champagne now. After all, you've got something to celebrate. Do you think if I called for a nurse, she might nip off and fetch a bottle or two?